This lecture is all about digestive disorders. So these are all things that can go wrong with the digestive system. This should go pretty quickly. You don't have to know a whole terrible lot about each of these. Just knowing the highlights is going to be what's important to you here. So this picture again, remember alimentary canal, oral cavity, esophagus, stomach, small intestine, large intestine. So teeth and mouth, some oral diseases here, gingivitis, which is an infection or inflammation of the gums. Periodontal disease, this is when gingiva get really inflamed and it starts to infect the bone. And the periodontal ligament, which is the ligament that can hold on to your teeth. This can become very, very serious. And then you have dental caries. This is also sometimes known as cavities, and this is just tooth decay. So some pretty easy ones here. This slide is talking all about how periodontal disease has now been linked to coronary heart disease and stroke. It turns out that the plaques that present in periodontal disease actually correspond to the plaques that you see in heart disease that also cause stroke. So they're hoping that by treating periodontal disease, you can actually treat cardiovascular disease. The esophagus, we've talked about this one a little bit already, heartburn or acid reflux and GERD. Remember, acid reflux is just when the stomach acid is leaving the stomach and entering the esophagus, thereby burning the esophagus, and that's why you feel that burning feeling in your chest. The GERD is a severe form of acid reflux that happens even without food intake, which is different from the standard heartburn or acid reflux. One last thing, acid reflux medications like the little purple pills, and the Pepto-Bismols, things like that, have actually been linked to kidney disease. This is brand new research that was released this year. And it's something to consider if you are thinking about taking heartburn medication, to really use that in moderation if it has an effect on the kidneys. Stomach. Pyloric stenosis, which is a new one. We didn't talk about this when we went through the stomach. This is where the pyloric sphincter is too tiny in infants. And what happens is it won't open wide enough. So babies often get impacted stomachs where their food, the milk that they're drinking and the formula that they're drinking is not actually moving past the stomach. It just gets all balled up in there and then they vomit. And this is often it's not often diagnosed and can sometimes just be passed off as colicky babies. And when it is diagnosed, what usually has to happen is the pyloric sphincter has to be surgically corrected. Peptic ulcer disease, we've talked about this one again before, I should say. This is where you have those ulcers caused by bacterial infections in the gastric pits that block mucus production, causing the gastric juices to eat away through the stomach lining. Duodenal ulcers, these are similar to peptic ulcers, only they are found in the duodenum. So bacterial infection causing those gastric juices to eat through the lining of the duodenum. Liver and pancreas. Most of these are in the liver. Cirrhosis is when you have chronic infection of the liver that can lead to scarring and destroying of the liver tissue. Hepatitis is an infection and inflammation of the liver caused by different viruses and drugs. Alcohol can also cause hepatitis. This includes different types of hepatitis A, B, C, D, and E. And there are different vaccines for some of the different types of hepatitis. Gallstones. What happens with gallstones is you get a precipitate of the bile collects and forms a hard, solid precipitate, and it blocks the flow of bile from the liver. And you have to actually go in surgically and remove that gallstone in order to get the bile flowing again. Pancreatitis. This is an inflammation or infection of the pancreas. Then you have small and large intestine. We've talked about some of these. Colorectal cancer we talked about a little bit before. And then colitis is just an infection or inflammation of the mucosa in the colon or rectum. Crohn's disease. This is an inflammation of the whole GI tract, resulting in usually really awful diarrhea and really painful, just aches and pains. Irritable bowel syndrome. This is where your body doesn't fully digest food and just empties your bowels very, very quickly, resulting in abdominal pain and diarrhea. Enteritis. This is when you have the small intestine inflamed or infected. And of course, you have hemorrhoids. Let me get back there. You have hemorrhoids, which are an inflammation of the blood vessels around the anus and rectum. This is usually caused by straining at the toilet. So by like pushing out your poop too hard, you can cause the blood vessels to kind of burst and become infected or to become strained. Often many women develop hemorrhoids during childbirth. Something to look forward to. And then two other disorders of the digestive system, also linked to neurological issues, anorexia and bulimia. I like to discuss these because it affects everyone, both males and females. And it's just unhealthy to treat food and your body in this way. Under eating or reduced calorie intake is really bad. And bulimia, that purging, does horrible things. These are all symptoms or side effects of each of these diseases. Things like fine hair growing on other parts of the body, sleeping problems, constipation that continues even after the anorexia has been treated, constipation that lasts basically the rest of the life of that person, brittle bones, so you have osteoporosis even at a young age, and if it's never treated, the person could die. With bulimia, what you see is muscle weakness. You get tooth decay. The stomach acid will actually eat away or dissolve your tooth enamel, so you can lose all your teeth. You have swollen fingers, constipation again. Your hair can fall out with some of these. I mean, it's really awful. And like I said, it affects both males and females equally. And many times, males with an eating disorder will not seek help because the stigma is that this is a disease just for women. So this is something to be aware of for young men as well as young women. So that is the end of disorders. Make sure you just have an overview of each of these. Some of them may be on your test.